Good afternoon and welcome to H360 Live. My name is Dave Duplay. I'm joined here in the studio this afternoon by my friend and colleague from H360, Miss Courtland Long. Courtland, it's so good to see you.
Good to see you, Dave.
So what about this weather we're having?
I know, it's really unbelievable.
It really is. We're going to be in the 70s by midweek, and I may have to have some out-of-the-office meetings. I just want to warn you right now that I may be absent a few afternoons.
I know you're going to go play hooky and go on a bike ride, and that time is not approved.
Okay. All right. Fair enough. Well, you know, Courtland, we have a great show this afternoon. We have Dr. Fred Lynn from Mount Sinai coming in. We're going to be talking to him about obstructive sleep apnea. He's going to be telling us what it is, educating us about the diagnosis, the treatment, what we can do about it. So it's going to be a really great show. Can't wait to get him in here. But Courtland, as always, we have some health tips for our audience, and these are right in line with what we're going to talk to Dr. Lynn about.
Absolutely. Well, these health tips are going to be very informative to anyone who thinks that they're struggling with obstructive sleep apnea. We're going to try to give you some tips to help you manage sleep with fewer breathing interruptions. So we'll just jump right in, and the very first tip is to sleep on your side. Now, gravity may make obstructive sleep apnea worse by helping your soft tissue and your tongue to fall back into your throat, causing an airway obstruction. So one way to help you sleep on your side is you could sew a tennis ball into the back of your t-shirt if that's what you wear when you're sleeping, or you could try to just stuff a pillow behind your back so you don't roll over onto your back if you start out sleeping on your side.
Now, Courtland, I have to ask, sew a tennis ball in the back of your sleep shirt. What is that going to do? So I'm assuming that when you lay on your back, it's going to be very uncomfortable with that tennis ball, and it's going to make you want to roll on your side.
Yeah, that's exactly the trick.
Yeah. Okay. Well, that's a great tip, and I would imagine that that would work because that tennis ball, kind of hard, very uncomfortable. You're going to be on your side. The next tip is to prop your head up. And Courtland, you know, if you prop the head of the bed up 4 to 6 inches and sleep on a little bit of an incline, that's going to do it for you as well. Now, there are foam wedges out there. Any home goods store, a Bed Bath & Beyond maybe, any place that has different types of pillows, you could get a wedge. You could use that as well, but if you prop your head up, it's going to leave that airway just a little bit open. I think you're going to get a better night's sleep.
I can imagine you could also just use 2 pillows if you don't want to go out and buy a specialty wedge.
Well, I, in fact, have 13 on my bed, so I could use many pillows if I need to prop my head up.
You certainly could.
I could.
Well, tip number 3 is to tighten the muscles that keep your mouth closed. And one way that you can try to do this before sleeping is to chew gum or hold a pencil between your teeth for about 10 minutes or until the muscles start to get a little bit fatigued.
Now, I can't wait to get Dr. Lynn in here and ask him about these home remedies that we've come up with to see if he's buying into this. But chewing on a pencil or biting a pencil very hard, or chewing gum right before you go to bed. Now, you have to be careful because you don't want to fall asleep with the gum in your mouth, which happened to me when I was a very young boy.
Oh, no.
Fell asleep with a big wad of bubble gum in my mouth. It didn't end up in my mouth in the morning. It, in fact, ended up in my hair.
Oh, no.
Yeah, and so it was very difficult for my parents to get it out. They ended up having to cut it out, and I went to school that day with a big clump of hair on the side of my head missing. Many hours of therapy. I'm finally over it, as you can see, but don't fall asleep with bubble gum in your mouth. So take, lesson learned.
Well, not only could it wind up in your mouth, but you run the risk of choking on it, too.
Absolutely.
Yeah.
You never want to fall asleep with gum in your mouth.
No.
Well, Courtland, we sent the interns out on the streets of New York to see what our friendly New Yorkers know about sleep apnea, sleep studies, and getting a good night's rest. Do you want to watch the video?
I would love to.
Okay, guys, please roll the video.
Do you know what sleep apnea is?
Yeah. I was tested for it.
Oh, really?
Yeah.
How did that go?
Partial, but manageable without any specific intervention.
No, I don't.
I do. It's like when you stop breathing in your sleep, right?
Yeah.
Okay.
Exactly.
Yeah, sort of, when you snore.
Do you ever find yourself having a hard time sleeping throughout the night?
No, I'm a heavy sleeper, so I have no problem sleeping.
Yeah, actually, last night.
Why?
I don't know. I think it's either like restlessness or anxiety or too much caffeine.
No, I managed to have good sleep. Yeah,
Okay.
because I pay a lot of attention to the. I feel it's very important for me.
I'm just a light sleeper, pretty like anxious personality, so stuff wakes me up a lot.
What position do you find most comfortable sleeping on? Like on your back or your side or?
I usually fall asleep on my back and then end up on my side.
Usually on my side.
Because of the sort of emerging sleep apnea, I have to sleep on my side. I can't sleep on my back.
I see.
Go to sleep on my stomach, but I always wake up on my back. I don't know why.
Have you ever heard of chewing on gum or chewing on a pen or pencil before you sleep in order to get a good night's rest?
No.
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 No. No.
It's supposed to help reduce like snoring and give you a better night's sleep. Would you ever try that?
Yeah, potentially if it's supposed to help. Yeah.
I don't know. I don't think so. No, I wouldn't try that. No. That sounds weird.
Yeah, I'm sure. If I'm snoring and it's causing problem for me or for my wife, I would.
You would try it?
Yeah.
Yeah.
But I don't have it now, so.
Would you ever try it?
Sure. Is it a real thing?
Yeah, apparently.
Okay.
Well, Courtland, what do you think?
Well, that was a great video, and you know what? One of the men that our interns interviewed actually is developing sleep apnea.
Is that right?
Yeah, he was talking about it in the video, and he does try to sleep on his side because he knows that it gets worse when he sleeps on his back.
Yeah. Now, a lot of the folks in the video were pretty well informed.
Mm-hmm, they
Right.
were.
Many of them are pretty well educated on what sleep apnea is.
Mm-hmm.
A lot of them, I think, correlated it to other things, maybe snoring a little bit.
Yeah,
But all the way around, it was a good video, very well educated.
it was. I think a lot of them were also surprised about that third tip of chewing on a pencil before going to bed.
Yeah, I don't think anybody was too quick to jump on that
No.
one, but we'll ask Dr. Lin when he's in.
Good.
Great job by the interns. Our friendly New Yorkers didn't disappoint as well, but Courtland, now is our favorite time of the show. Dr. Lin is making his way in the studio, and before he sits down and we get underway, I've got a few things I want to say about sleep apnea. So, obstructive sleep apnea is a common and serious sleep disorder that causes you to stop breathing during sleep due to the airway being blocked. So we're going to learn all about that. 1 in 5 adults have mild obstructive sleep apnea, about 1 in 15 moderate to severe, and people with moderate or severe sleep apnea have somewhere in the area of a 9 to 13 times increase of being involved in a traffic accident. That's a
Wow.
big number, Courtland.
Yeah.
And that's primarily due to exhaustion and really kind of falling asleep at the wheel. Well, Dr. Lin, it's so good to see you. Thanks for joining us this afternoon.
Thanks for having me.
So we have so many things that we want to talk to you about. The sleep apnea is a fascinating topic, so let's jump right in.
Sure.
Well, Dr. Lin, Dave just gave us a little bit of an overview of what obstructive sleep apnea is, but can you really give us a thorough explanation of it?
Sure. So, as I'm sure everyone knows, sleep happens from very light sleep to very deep sleep. And as you go into deeper sleep, your muscles in your body relax more and more. The muscles in your throat that allow you to eat, chew, drink, talk, breathe, etc., also relax. And unfortunately, for some people, that relax causes enough collapse to cause narrowing of the airway. In those cases where that airway collapses, they can get something called a hypopnea, which is decreased breathing, or an apnea, which is complete blockage of the airway. And in both cases, oxygen levels in your body go down, and your brain realizes that and pulls you out of that deep sleep to regain that muscle tension to open up your airway again. And then the cycle repeats itself over and over and over again throughout the night. So if patients have enough of these occurring, they have sleep apnea, and that's usually done through a sleep study to see if these are occurring or not.
Now, when you say enough of these occurring, what kind of numbers are we talking about?
So if someone has more than 5 apneas or hypopneas per hour based on the study, they have sleep apnea. So 5 to 15 is mild, 15 to 30 events per hour is moderate, and 30 or more events per hour is considered severe.
Interesting.
Well, so let's talk about snoring for a moment. So I think a lot of people assume that if you snore, then you must have sleep apnea, and if you don't snore, then maybe you don't have sleep apnea. Is this true?
So snoring can be a sign of sleep apnea. It's not necessarily true that if you have snoring, you definitely have it. Again, it's kind of just a warning sign. As your muscles relax more, muscle relaxation, that tissue relaxation can cause snoring where the tissues just vibrate. We're not really sure as far as observation whether you can actually tease out whether you have sleep apnea right away. But the sleep study lets us kind of delineate that further and kind of figure out if you have sleep apnea or not. Now, if you don't snore, it doesn't necessarily mean they don't have some form of sleep apnea. Some patients have something called central sleep apnea, where your brain basically just doesn't make you breathe at night when you sleep, and that is also a form of basically not breathing at night, and you're not going to snore in those cases. And so, and also in severe sleep apnea patients, it's just obstructive, where you don't breathe at all. Of course, there's no airflow, you're not going to get that noise either. And so, they're not mutually exclusive, but snoring can definitely be a sign of possible sleep apnea.
Mm-hmm. So let's talk about breathing for a minute, because this is kind of fascinating to me. So if you're asleep, are you breathing through your mouth and your nose simultaneously, or sometimes just your nose, sometimes just your mouth? And is there any correlation to sleep apnea whether you're breathing through your nose or your mouth?
So ideally, you'd be a nose breather. Most people, I think, should be nose breathers or nasal breathers. If they have congestion, or if the roof of your mouth, the palate, falls back and closes off that nasal airway, of course you're going to have to open your mouth to breathe through your mouth. Unfortunately, when you breathe through your mouth, your jaw falls open and your tongue falls back, and so that can create narrowing as well. And so most people, we try to get them to be nasal breathers if we can, but if they're mouth breathers, it doesn't necessarily mean they have sleep apnea, but they're just going to have a little bit more noise, a little bit more collapse in the airway.
Go ahead.
So one more thing. So now I wear a night guard.
Mm-hmm.
I tend to grind a little
Yeah.
bit, and so my mouth is naturally open because of the position of the night guard.
Mm-hmm.
So could that lend itself to sleep apnea?
No, most people, again, just because you're opening your mouth doesn't mean you have sleep apnea. It's just the tongue may fall back a little bit,
Yeah.
but the night guard shouldn't create any issues. If you're going to breathe through your nose, you'll breathe through your nose with the mouth guard or the night guard in place. If you're a mouth breather by birth and by training, then you'll just keep breathing through your mouth.
Got it. And how about obesity? Is there a correlation with body mass index and sleep apnea?
Absolutely. It's definitely a warning sign as well. As you gain more weight, the thickness of the throat gets a little bit bigger, and the tissues end up collapsing a little bit more. Also, you can get something called central obesity related hypoventilation, where if there's a lot of weight around the belly, your diaphragm's not going to be able to expand as much, so you don't breathe as heavily or as deeply. And those can also be things that can lend itself to sleep apnea.
So what really sparked your interest in this field of medicine and being a sleep surgeon and helping these nose breathers and mouth breathers?
So, I think as far as ear, nose, and throat goes, my field, it's a very, very underrepresented area that clearly needs a lot of people that should be trained in it and need to be able to do advanced procedures. And so I saw it was an area that didn't have very much interest as far as the general ENT population. Everyone knows someone that snores. Everyone that knows someone that has possibly sleep apnea or falls asleep at dinner or falls asleep watching TV. It was an area that I felt was interesting, was something that was ripe for research and kind of new developments, and something that was exciting, and so that kind of sparked my interest.
So you hit on a key word, advanced procedures, being trained to perform these advanced procedures. So what are some of the surgical procedures? Let's maybe kind of go from the least invasive to the more significant.
So usually working up the ladder of advancement. The most basic procedure for improving things like CPAP tolerance, which is continuous positive airway pressure for treatment for sleep apnea, is by fixing a deviated septum, improving nasal breathing, improving their nighttime nasal breathing when they lay down. And so there's a lot of office-based procedures that can help with that. Reducing tissues in the sides of the nose can help improve breathing. Fixing a deviated septum in the operating room can also improve nasal breathing at night in some cases, and that can sometimes improve CPAP tolerance. As you move up in that more invasiveness, there are surgeries to help improve the airway along the palate, which is the roof of your mouth where the little uvula, the punching bag is, and the tonsils. And so there are procedures that reshape that area to give you more space. If it's a tongue obstruction, we have surgeries that help reduce tissue at the back of the tongue to create more space as well. Some of the more advanced things that we do now is robotic surgery at the base of the tongue to try to reduce that tissue. We actually use a robot to go in and take tissue from the back of the tongue to create more space. I believe one of your previous segments talked about a stimulator device. It's a device that basically stimulates the tongue to move forward to create more space. That's something that's fairly new. And then there's also jaw surgery by actually improving the skeletal airway, moving the upper and lower jaws forward to give you more space back there. That's usually in very severe cases. The most invasive thing that we don't do very much anymore is actually bypassing the airway, using an airway through the neck called a tracheostomy. Luckily, we don't have to do that very often anymore, but those are all kind of the major options for surgery right now.
So would it be safe to say that you'd go through your entire practice and not see one of those surgeries?
It's pretty safe to say. I think most patients would refuse that and
Yeah.
would rather just deal with the CPAP or medical therapy or other surgical therapies. And so usually that's reserved for patients that are very, very sick, that have very, very severe sleep apnea and have no other recourse. And so, we see it sometimes, but it's not something you see very often in practice.
What are some of the medical therapies that you can use for patients?
So the gold standard for someone that has moderate or severe sleep apnea is CPAP, continuous positive airway pressure. Basically, I'm sure people have seen it on TV where there's a machine hooked up to a hose, hooked to a mask, either to the nose or the full face, and that blows air through the airway to use pneumatic pressure to keep your airway open. There's different versions of it. There's something called CPAP, which is continuous, one pressure throughout the night. There's something called BiPAP, where it's one pressure in, and then as you breathe out, the pressure decreases to a second pressure. And then there's AutoPAP, which is a machine that self-adjusts based on what you need at night. And that is, again, considered the gold standard for therapy. For people that tolerate it, they do great. They feel better in the morning, they don't snore anymore, and they never sleep without it, really. But the problem is that half of patients end up using it, half of patients find that it's cumbersome and they can't tolerate it and they throw it in the closet and never look at it again.
How do you decide, if one surgery is best for a patient, or if they should try to do the CPAP, take it out of the closet, try it again?
Well, most moderate patients or severe patients, we definitely push CPAP first. Something that most insurances require anyways, and it's the gold standard, so they should try it. If they failed it, a lot of the times if we take a look at their airways and there's not much we can possibly do for them surgically, then we'll say, yeah, CPAP may be a better option. Let's try again. Let's try to do things to try to make you tolerate CPAP better, whether that's improving the nasal airway or trying to do positional therapies or even having them meet with the sleep medicine doctors again to kind of get them to get used to the machine a little bit more. A lot of times they just get the machine, they're not really told what to do and how to get used to it. And so seeing a sleep medicine doctor that's trained in trying to get patients to use the machine more sometimes is very helpful as well.
So does this condition go underdiagnosed quite a bit? And if so, what are some of the kind of the telltale signs that might indicate that you have sleep apnea?
Absolutely. The major problem of sleep apnea is that it happens when you're sleeping, so you don't really know that you have it. It's mostly bed partners, family members that will tell patients that they need to go in and see someone about this because the snoring is so bad, or if they're at home, they're always sleepy, they're always kind of out of it. And so things like warning signs like very heavy snoring, daytime tiredness, morning headaches, even heartburn or unexplained high blood pressure in some cases can be a sign of possible sleep apnea. And so a lot of times it's the primary care doctor that screens them, family members that really push them to get seen and examined.
In the beginning of the show, you mentioned some conditions that could be related to sleep apnea. So what are some of the risks of sleep apnea going untreated?
So things that I mentioned before are the major things: high blood pressure, heart failure, stroke, irregular heartbeats. Cardiovascular issues, basically, where you can imagine as you go through the night and you're having these obstructions, you're constantly in this fight or flight response over and over and over again. And so if your body goes through that throughout the night when it should be resting, it's going to put a toll on the cardiovascular system and the heart, and so in the blood vessels, et cetera. And so those things have been shown to possibly be increasing risk from sleep apnea. Other things that can be related, things like diabetes, things like weight gain, are all things that are peripherally possibly related to sleep apnea as well.
Now, you mentioned sleep studies, and there are sleep studies in a clinical setting and sleep studies done at home. Can you tell our audience the difference between the two and what happens in a clinical sleep study that doesn't happen at a home study?
So, in-facility sleep studies are traditionally the standard sleep study, and that basically is a study where you go in at night, you put a bunch of monitors on you, including things like EEG monitoring to measure your brain waves, EMG monitoring to measure your muscle activity, there's a camera watching you to see if you're flipping and turning at all, there's things that measure your breathing as well as your oxygen levels, and those studies are done overnight again and were considered the gold standard before. As technology has improved, home studies have become more popular, and a lot of insurances actually push for a home study because you don't have to have a technician watching you overnight. And home studies have gotten quite a bit better. They basically only measure things for sleep apnea in most cases, although there are different variations of the machines that you can take home to do studies. Most studies will measure basically oxygen levels and breathing patterns. Some will measure things like leg movements, but for the most part, it'll just determine whether you have sleep apnea or not. And in most cases, it has been shown to be very, very effective in screening patients for sleep apnea.
So when we were chatting with you before the show, you briefly mentioned some of the research that you do. Can you talk with us a little further about your research areas?
Absolutely. So, again, I think it's an area that's ripe for a lot of new research coming through. One of the things that we used to look at, or we looked at before in the past, was looking at ear pressure related to CPAP machines. There is a tube that connects your ear to into your nose, and by using the CPAP, you can just imagine the air blowing through can cause ear pressure. And so we looked at the increasing ear pressures related to CPAP machines, which actually we did show occur. Other things that are interesting are things like looking at the robotic surgery. Robotic surgery is fairly new. We're looking at its effectiveness and whether it's a good quality therapy for sleep apnea procedures. We're looking at the stimulator device, whether that is also a good option for therapy. Other things include things like head and neck cancer. Patients that are treated for head and neck cancer have to get radiation chemotherapy to the airway. We're looking to see if that's affecting sleep apnea and whether that's causing sleep apnea in some patients as well.
So at Mount Sinai, I know a lot of the areas of medicine, there's a multidisciplinary team. In your area of specialization, what other kinds of physicians are you working with?
Absolutely. It's very, very important that we have a multidisciplinary center. Sleep apnea affects so many different things. We work very closely with the cardiology team, of course. A lot of the patients have cardiovascular issues, and so we have a very close relationship with them, sending patients back and forth to be evaluated. We have them see dental specialists in some cases. One of the medical devices that you can use to treat sleep apnea is a dental device that you wear at night that pulls the jaw and the tongue forward a little bit. It's like an upper and lower retainer. So we have a close relationship with them to try and use medical devices to treat sleep apnea. The pulmonologists, a lot of lung issues, a lot of sleep medicine doctors, a lot of pulmonologists end up being sleep medicine doctors, so it's a very close relationship there. The endocrinologist and the bariatric surgeons as well. If patients are overweight and they're not able to lose the weight, we have them see a weight specialist, a nutrition specialist to try to get them to lose the weight. And if they're not able to do that, then possibly even consider bariatric surgery to help lose the weight that way.
So it's National Sleep Awareness Week. So what are some things that people can do to learn more about sleep disorders and help spread awareness?
Absolutely. I think there's a lot of information on the internet these days about sleep apnea. You just want to make sure you use the correct websites, places that are known to have good information. The American Academy of Sleep Medicine has a great website. We also have a great website at mountsinai.org/sleep-surgery. And anywhere that most primary care offices, I think, will have some information about it as well.
Well, Dr. Lin, I want to thank you for coming in. This has been very informative. I may come in and do a sleep study with you. We'll see.
We'll be happy to have you anytime.
Okay, very good. So thanks again for coming in. I'd like to thank our viewers this afternoon for tuning in, and I'd like to thank our sponsors for making this all possible. Remember, all of our episodes can be found on demand at healthy360.com, and our podcast can be found in the iTunes store. Well, we're all about social media, and Courtland's going to share that with you.
We're all over Facebook, Instagram, Twitter, and Pinterest. We use the hashtag RealStories when posting, and we'd greatly appreciate it if you would do the same. On behalf of Dave Duplay, myself, and the entire Healthy 360 family, we'd like to thank you again for joining us today, and we look forward to seeing you again next week when we're chatting with Lou Ellen Barkin of Caring Kind.